Injectable weight loss medication has risen in popularity drastically over the past year or so, and with good reason. They've been super effective not only for patients with type 2 diabetes, but now it has been FDA approved in patients who are overweight or have obesity. We've had a lot of success here at Aviva Plastic Surgery using those injectable medications for those patients. We carry both tirzepatide and semaglutide. They're both in the same family of injectable weight loss medications. However, semaglutide is a single receptor agonist and tirzepatide is a dual receptor agonist. Typically here we like to start with a consultation for our weight loss program, and there we'll go over your goals, talk about how much weight you're looking to lose, kind of what your history is with dieting, weight loss, how you've carried weight throughout the years and things like that. And from there, we'll decide whether or not you're a good candidate. We'll look at some baseline blood work and make sure everything looks good there, and then we can get started. So we usually start with a baseline dose just to get your body used to the medication, and then we will increase or not depending on your side effects or how much weight you're losing. So we'll kind of cater it to how you're tolerating the medication and how effective each dose is. Typical side effects, the literature says that nausea, stomach ache, vomiting, constipation, things like that are the most common ones. I think realistically, the most common side effects that I see are going to be fatigue and heartburn. So just because of the nature of the medication, it's slowing your gastric emptying. So food is sitting in your stomach for a little bit longer. So you go lay down and it wants to travel back up. So those are kind of the two side effects that I see most commonly. Our medication is a compounded medication, so it does have vitamin B12 compounded into it, and this is really nice for those fatigue and nausea symptoms. It can help combat those. So I have a lot of patients ask me, how long am I going to be on this medication? How long do I have to take it? What happens when I come off of the medication? And those are great questions. So what I tell people is I usually separate patients into two categories. So the first category are going to be patients who have struggled with weight their entire life. They've, been overweight since they were a child and have kind of struggled their entire life to keep off weight and things like that. And then the other group of people are going to be patients who, have been, a relatively stable weight their whole life, but maybe due to certain circumstances, whether they just had a baby or went through a hardship or whatever it may be, have gained weight and they just kind of want to get back to their baseline or where they, are comfortable. And so for those type of people, I think it is realistic to take the medication until you kind of get to your goal weight. And then from there, we can either wean you off the medication, or we can do like maybe a once a month injection to kind of maintain your results. So, and we can kind of work with that in a couple different ways. So we can wean you off and see how you do without the medication, or, we can kind of just go ahead and do the monthly maintenance. So it kind of depends. And then the first group of patients who have dealt with obesity chronically, they're a little bit different. So they're going to treat their chronic condition like any other chronic condition, and they're probably going to be on the medication long term. Overall, we've had so much success here at Aviva with these weight loss injections, and it's been such a rewarding process to see people reach their goals and tell me, their cholesterol hasn't been this good in years. So it's been a really great process, and if this sounds like something you'd be interested in, give us a call and we'd love to schedule you for a consultation.